This is an information video about our heartbeat study to find out if a digital therapy can be used to help people with anxiety that are also using NHS mental health services. We are a group of researchers in Brighton who are doing a study about anxiety. A study means that we are looking at something to find out more about it. Our study is called HeartRater. We are getting in touch because you might be able to take part in our study. To help you decide if you want to take part, please listen to the rest of this video. Everybody feels anxious at some points in their life. Things like a job interview or a hard test can make us feel anxious. It's normal to feel anxious about these things. Sometimes anxiety lasts a long time and can make us feel scared and upset. If this happens, therapy might be helpful. We often feel anxiety in our bodies. For example, our heartbeat may feel faster or stronger, or we might feel our breathing change. We are looking at how our heartbeat changes in this study. We have made a therapy that we have called ADIE. ADIE stands for Aligning Dimensions of Interoceptive Experience. This therapy helps with the feelings in our body when we feel anxious. ADIE teaches you to feel your heartbeat better. This helps some people to feel less anxious. ADIE is a digital therapy. Digital therapy means using a computer to do therapy at home. We use a special electronic tablet for ADIE therapy. This tablet is called HeartRater. It listens to your heartbeat and tells you what to do. To listen to your heartbeats, ADIE will ask you to put stickers onto your chest and tummy. You can do this yourself at home by looking at instructions on HeartRater. If you take part in the study, we will send HeartRater electronic tablets to your home in the post with instructions on how to use it. We want to recruit people who feel anxious for our study. We want to see if ADIE therapy will be a good part of NHS mental health services. People who use ADIE therapy will use it for 10 weeks at home with the HeartRater electronic tablet. After that, we will ask questions about how it went and what you thought. We will use what you and other people tell us about ADIE therapy and HeartRater to make it better. You can take part in the study if you're 18 years or older, if you feel anxious, if you have a phone or computer for video calls, and if you have the internet where you live. You cannot take part in this study if you worry a lot about your heart. In stage 1, one of the researchers will talk to you and check if you can take part. They will ask you some questions. This is called an assessment. You can choose how we talk with you. We can talk with you on the phone or in person or using text on your phone. We can also send you an email with a link to the website. On this website, there will be questions for you to answer to give us information. If you can take part, you will move on to stage 2, where we will be putting people into 2 groups. If you're in group 1, you will do ADIE therapy with the therapist. The therapist will need to talk to you on a video call. If you're put into group 2, you will do ADIE therapy without a therapist for 10 weeks. A computer decides which group you go into. Once we know which group you're in, we'll send you the kit in the post with a guide as to how to use it. Stage 3 will happen when you get the electronic tablet. HeartRater will ask you to do some tasks and ask you some questions for about 2 hours in the first week. This is another assessment session for everyone to do in both groups. Then you will have 4 weeks of ADIE therapy. Then you will have another assessment, which we will have the same questions. Then 2 more weeks of ADIE therapy, and then a final assessment with the same questions again, and some further questions. In stage 4, after you've finished ADIE therapy, people in both groups will talk to the therapist. They will ask if you want more help with feeling anxious and what help you would like. You can also choose to take part in an interview about what you think of ADIE therapy and HeartRater. We will then have a mail delivery person come and pick up the HeartRater electronic tablet from your home. The study team will look at the results of the study and write about them in a science magazine. We will also write a simple summary. You can ask them for a copy of this. For each of the assessments, we will pay you £10 an hour. You will either get £55 or £65 total, depending on if you join the interview at the end. We will also pay you for any travel that you need, help taking care of your children, an interpreter if you prefer to speak a different language other than English, and other things that you may need. If you need anything like this, please email the study team using the email on the screen to let us know. You do not have to take part if you do not want to. Nothing bad will happen if you do not take part. If you decide to take part, you can change your mind at any time. ADIE may help with your anxiety. You will also help us to learn more about helping others with anxiety. Learning more about your heart can make some people worry more. The tests we do are not to find out if you have a medical problem. Sometimes we still find a possible issue. If we find any possible issues, we will tell your GP. Your GP can then get in touch with you if more tests are needed. If you take part in this study, we need to know some personal information about you. We will need your name, phone number, and email address. Only people working on the study will see your personal information. We will also see your information from assessments and from your ADIE therapy sessions. We will not see what you talk about with the therapist. We will see information about how you do on the tasks and how you answer the questions in the assessments. Some of the information might be shared with other people or study teams. They will not know it was you who told us. Your information from the therapy and assessments will have a code number instead of your name or contact information. We will store your information in a safe and secure place. The government is happy for us to do this study. If you're unhappy about anything that happens in the study, you can complain. Complaining is when you tell us about why you were unhappy. If you want to complain, you can contact Amy Carter. Amy is part of the study team. You can contact her by email, phone or text with the contact information on the screen. You can also complain outside of the study team. Please tell us if you feel unwell and need to visit a doctor or nurse whilst you're taking part in the study. You can tell us by email if you feel unwell using the contact information on the screen. You can contact a person on the research team using email, phone or text. If you have any more questions, the screen will show contact details for Amy Carter that you can use. Thank you for watching this video.